COVID cases rose after our holiday travel helped the virus spread. Now, infections are declining again. Over the past 14 days, nearly all states have seen a slight decrease in cases. This morning, CDC Director Rochelle Walensky reiterated that this trend depends on us doing our part.
It's encouraging to see these trends coming down, but they're coming down from an extraordinarily high place. And as I said earlier, if we want to get our children back to school, and I believe we all do, it all depends on how much community spread is out there. We need to all take responsibility to decrease that community spread, including mask wearing, so that we can get our kids and our society back.
Despite the decrease in cases, the U.S. could pass 500,000 coronavirus deaths within the next few days. Let's get to some more of your COVID-19 questions with Dr. Kavita Patel, MSNBC medical contributor and former Obama White House health policy director. Dr. Patel, good evening.
Good evening, Joshua.
I understand you have a Valentine's Day poem for us.
Yes, I thought it was fitting today. Roses are red, violets are blue. I'm really sick of COVID. How about you? And that sums up how I think a lot of us feel these days.
Yes, I agree, and I feel loved at the same time. I would love for you to help us answer some of these questions, particularly new questions about the vaccines. One viewer wants to know, what is the status of the AstraZeneca vaccine? Other countries are using it. When will it be approved in the U.S.? And if given the chance to get in a trial in the U.S., would that be better than waiting 4 months for one of the others? So two-part question. What's the status of the AstraZeneca vaccine, and what about taking part in a vaccine trial?
Yeah, it's a great question. First part, we are in the middle of phase 3 in the United States for the AstraZeneca vaccine. So that phase has to be completed and the data has to be analyzed. So we're talking, Joshua, months. It's not going to be weeks. It'll be months. And then in terms of the second part of the question, I'm a big fan of research and science, and I think participating in a trial should be your decision, but it's not an either or. I think it's absolutely something that you can participate in a trial now and talk to the trial researchers that if your turn comes to get the vaccine, what do they recommend? They are ready for these questions, and they're also trying to make sure that nobody is denied the opportunity to receive one of the authorized vaccines. We only have 2 right now, Joshua, but that number will increase over time.
Another viewer asked about the current COVID tests, whether they can detect the variants of COVID we've been hearing about.
Yeah, and yes, the short answer is yes. And it's because really what the tests are looking for is copies of the RNA, the genetic material of the coronavirus. And you can actually look at the copies and look for those mutations that we've talked about, B117, B1351. And then interestingly, some researchers have found that the absence, that each of these RNA look like a fingerprint, and the absence of some of those pieces of the fingerprint can be a clue to telling what the variants might be. So yes, we do have ways to check for it.
Lori asks, I have been trying to understand what the percentage means when referring to the vaccine. 95% effective means 5% of the people vaccinated can still get it, but not severely? 60% for the Johnson & Johnson means 40% can get it. What does the percent have to do with the severity that this vaccine protects you from getting severe symptoms, they say? Doctor?
Yeah, Joshua, this is the most common question and a great one that Lori asked. The percentage of efficacy really refers to the risk reduction of getting symptomatic or severe COVID-19 compared, Joshua, to a population that is not vaccinated. So the absolute numbers are literally like 7 amongst 10,000 people who are vaccinated will get severe COVID, not 5% or 5 of 100. So it's much better news than the percentages might lead you to believe. The most important percentage really is the fact that the Johnson & Johnson vaccine, as you mentioned, that they get an 85% reduction of severe disease. And that's really what we're looking for. Remember, these trials were set up to look for an ability to stop severe disease and death. And then everything else, symptomatic, mild, moderate illness, is also been decreased because of the vaccine. But it's a relative risk reduction.
Donna wants to know, once you get the COVID vaccine, how long will you be protected? Also, when your protection wears off, will you be able to get another vaccine, or do you have to wait till everyone is already vaccinated?
Yeah, great question, Donna. The CEO of Moderna intimated that their immunity could last for years, but the truth is that across all the vaccines, we don't know. We expect it to be at least months, but we're looking at people like me who got vaccinated in December, pretty early, and people are trying to measure how long our immunity lasts. So the question about will you need to get a second vaccine or a booster or anything like that, I do think that we are looking at potentially an annual or seasonal vaccine. And that's something that we've gotten used to with the flu, but we're still trying to figure out, and all the manufacturers are currently working on boosters or tweaking their vaccines to deal with the variants we're seeing.
I'm going to ask if we could flip our last two questions in order, because Sarah has a question I would really like to get to that has to do with something that's come up for the last few days. Sarah asks, please explain why KN95 masks are better or not than surgical masks or double surgical masks. I thought KN95 superior because it's a tight seal. True or false? Dr. Patel, can we just broaden this question out a bit and talk about masks, what we know about masks right now, particularly after hearing research that double masking is more than 90% effective at blocking COVID-19? What do we need to know about masks right now?
Yeah, the CDC did a simulation model, and here's what we know. Those surgical masks that you can, with the blue and the little loops around it, that if you put that on and then put a 3-layer fabric mask over it, so essentially a double mask, which adds up to 6 layers, that can get you even higher potentially than 95%, which is amazing. And if you can't do that, because sometimes it's not comfortable, your face, or if you wear glasses, you might not be able to do that, you can still wear that surgical mask and tie little loops on the side. The CDC website has a great little graphic to show you how to do it. And that can also be much better than just the surgical mask by itself. The KN95 means that it's not approved like the N95s are by the FDA. However, and you have to make sure that you aren't getting one of the brands that's actually been flagged by the FDA for being counterfeit or fake. But if you can get a KN95 and wear it comfortably, that 95 means that it filters out about 95% of the particles. And we think COVID can be prevented by filtration and distance and everything we've talked about. So a KN95 can be hard for some people to wear for several hours, Joshua. So that double masking or tying the loops on the side of a surgical mask might be your best way to go.
Dr. Kavita Patel, we appreciate your help as always with these questions. Thanks very much.
Thank you.
And if you still have questions about the vaccine, our parent company, Comcast NBC Universal, has a new website for you. We are very excited about this. It's called Plan Your Vaccine. It's got what you need to know about getting vaccinated, including information for different states, information if you have high-risk health conditions, or if you are an essential worker. You'll find it online at planyourvaccine.com.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.